You, Natasha. Good morning, everyone, and welcome to Alcar Health's first webinar of the year. As Natasha mentioned, we are proud to partner once again with Justice in Aging. And our title is 2026 Medicare Changes and California Updates. So buckle up. There's a lot of information. We know that there's a lot of changes that are coming at us every day. There's a lot of changes that will be coming throughout the year. So the importance of this conversation today is really to bring that information forward, to address any questions that you all may have, and more importantly, to advise on where you can get resources. And we're proud to have Justice in Aging. So before I begin and hand this over to Tiffany, I do want to just cover some housekeeping items, and that would be number one, we do want this to be an interactive session once the presentation has concluded. So during the presentation, if you think of questions, please utilize the Q&A access in the Zoom link. Please go ahead and wait till the end of the presentation. We'll go ahead and address all your questions then. And as a reminder, we are recording today's webinar and we'll be sharing it after the presentation concludes. But without any further ado, I'd like to introduce Tiffany Huyenh-Cho, our presenter for today.
All right, thank you, Johanna, and thank you everyone for joining today. I'm excited to present. I'm going to share my screen. Okay. So like Johanna said, I will be covering updates to Medicare as well as some changes to coverage within California. There's been a lot that's happened in the last year, so we'll talk about the substantive pieces and then have time for questions at the end. For those that don't know us, Justice in Aging is a national organization. We are a nonprofit law firm and we use the power of law to fight senior poverty. So many topics that we focus on is healthcare for low-income older adults in the areas of Medicare and Medi-Cal. We also focus on economic security, like housing, as well as Social Security benefits, and we've been around since 1972. And our focus groups are low-income older adults who have been marginalized and excluded from justice. So women, people of color, LGBTQ+, and people with limited English. If you're not already signed up or if you're interested, we do have a listserv and we send out information about different changes that are happening. And we do have a California focused email listserv where you can get updates about relevant topics in the areas of health, housing, etc. And for today's agenda, I will be covering changes to Medicare as well as Medicaid, or as it's called, Medi-Cal in California, that have happened at the federal level. And then we'll also discuss some of the state level changes that have happened to our Medi-Cal program. And throughout, I will provide some tips and resources for folks and then have time for questions. But before we get into the specific topics, I do have two polling questions just to get a sense of where everyone is at with some of this information. So the first question is, have you heard about HR 1 and the federal changes to Medi-Cal?
We'll give it about 20 more seconds and I'll end that poll for you, Tiffany. So you can see the results before I launch the second question.
Great. So it does sound like The majority of you have heard about HR1 and those changes, about 60, almost 60%, and then the rest have not. So that's great. We have a good mix.
And then here's our second question.
Second question, does your organization have a list of local resources when people have questions about their Medi-Cal benefits?
We have about 10 more seconds and I'll end this poll and share the results. Okay, the results are showing.
Great. And it seems like a bigger majority of you, about 70%, do have a list of local resources and about 30% do not. So that's helpful to know. We will talk about, some of those resources that could be helpful with the different changes that are happening. Okay. So before we get into the topics, I just want to level set about, how does Medicaid impact older adults? Nationwide, we have about 80 million people that are on Medicaid. That is the federal name for Medi-Cal. They depend on Medicaid for health and long-term care, and 13 million people are seniors and people with disabilities. Within California itself, we have 2.3 million older adults and people with disabilities that are on Medi-Cal in California. And then there are also older adults that may not be over 65, but older than 50 who are enrolled in Medicaid, but through our expansion programs, also called the Affordable Care Act expansion or the new adult group. But this is the Medi-Cal category that was created through the Affordable Care Act back in 2014. And there's about 5 million adults enrolled in that category, and almost 6% of them use long-term care services and supports. So things like care in a nursing home, in-home supportive services or IHSS, as well as other home and community-based services that help people remain at home instead of going into a nursing facility. So Medicaid is very broad. It is, health insurance, but it also covers more than just traditional medical care. And this is where Medi-Cal is very different than Medicare, our federal health insurance program, because Medi-Cal does cover those other non-medical services. So IHSS, transportation to a doctor, as well as vision and dental, and then long-term care in a nursing facility. Those are services covered by Medi-Cal, but not Medicare. So for older adults, Medi-Cal is extremely crucial because it's covering those services that aren't covered under Medicare, and that are very important as you get older. If you want to remain at home, but you need additional support so that you can live safely in your home, that is where Medi-Cal will come in and help you or give you some of those supports. Otherwise, you would have to pay out of pocket for them through private care or pay special plans to get those type of services, but they are usually out of reach for very low income people. So there's been a lot of changes that have happened this last year at the federal level. HR1 is a budget bill that was passed by the federal government. It was passed in 2025 over the summer in July. It's also called the One Big Beautiful Budget Act or One Big Beautiful Act, OBA. But HR 1 is the official name. So we've been referring to it as HR 1. It does make several changes to Medicare and Medi-Cal. All of these changes amount to the largest cut to Medicaid in history. It was estimated by the Congressional Budget Office to be $990 billion. Medicaid is a state-funded and federally funded program. Both California and the federal government jointly fund Medicaid in California. So states run their Medicaid program and then receive partial reimbursement from the federal government for care that's provided under Medicaid. So under HR 1, in order to offer tax cuts to the wealthy or to offset budget costs for other government programs, HR 1 reduced the amount of federal reimbursement that it pays to states for Medicaid services. It also made it much more difficult to qualify and remain on Medicaid for certain people. And that means fewer people will be enrolled in Medicaid because it is harder, and fewer people also means less funding to the states because there's fewer people on the program. It's estimated that 4 million people in California will become uninsured as a result. Over 3 million people will have Medi-Cal terminated, and then the remaining could become uninsured because of the ending of those premium tax credits that people can use to sign up for private healthcare on the covered California marketplace exchange. So the premium tax subsidies that help offset the cost of private health insurance. HR 1 did not extend those tax credits as well. So the top line impacts because of HR 1 is it makes it harder to access Medi-Cal because it increases those barriers. And then it also terminates eligibility for Medi-Cal, Medicare, and those covered California tax credits for many immigrants. So there is going to be a large group of immigrants who no longer qualify for Medi-Cal, Medicare, or those tax credits under HR 1. So the two in blue are changes that impact who are eligible for Medicaid and Medicare. And then the last bullet is that because of all of these changes and the cuts to funding, California will have less funding to operate their Medi-Cal program. And that puts California in a really difficult position. So they will be forced to make difficult decisions to balance the budget. That could be cutting services within Medi-Cal. It could be making it harder to qualify for Medi-Cal under state rules, as well as lower the reimbursement that it pays to providers who serve Medi-Cal enrollees. So a lot of different changes that can happen under HR 1 just because of those funding cuts. So one thing to know with HR 1 is that it does not impact everybody enrolled in Medi-Cal directly. It's most of the eligibility changes are geared towards younger people. Because Medi-Cal, although it provides an umbrella set of health coverage to all different groups, older adults, younger adults, children, etc., eligibility for Medi-Cal is divided into different categories or pathways. If you're an older adult, over 65, or if you have Medicare, you're dual eligible, or you're a person with a disability, you are likely on you are on a different program than younger adults. Our traditional Medi-Cal categories are based on some sort of characteristic, like your age or your disability. It's the age and disabled, the share of cost program, the Medicare savings programs. Those are the categories that serve older adults, dual eligibles, and people with disabilities. So you have to be low income and also be over 65, for example, to be on aged and disabled. Then we have our 138 expansion Medi-Cal program. This is the category created through the Affordable Care Act, where you qualify based on income alone. You don't have to show some other linkage like age or disability. And for this 138 expansion, it's called the expansion group, new adult group. Sometimes it's called the Magi group. It has many different names, but it is limited to people ages 19 through 64 and who do not have Medicare. If you're over 65 or if you have Medicare, you are prohibited from this program. And I bring this up because most of the changes under HR 1 to Medi-Cal itself apply to this 138 group that are ages 19 to 64 and who do not have Medicare. And we have these different groups because there is different federal reimbursement attached to these different categories. So that's partly why there's different groups, but it also means there are different rules about how to qualify based on the group that you are in. So in that 138 group, again, it's 19 to 64 who do not have Medicare. But you could still be an older adult who is age 50 to 64. You're not yet at retirement age or not yet at Medicare age. So 21% of all California adults that are age 50 to 64 are on Medi-Cal. You could see people that have Social Security disability benefits, but don't yet have Medicare. They're in that waiting period. So they could be on the 138 category. It could also be younger caregivers of older adults. So adult children caring for their older parents may be on Medi-Cal themselves. So these are just some of the people that are in this 138% expansion category. So, with the HR 1 changes, like I mentioned, it does make sweeping changes to Medi-Cal and Medicare, but not all groups are equally impacted. Most of the changes are targeting that younger 19 to 64, 138% group. So, one of the big changes that is happening is the retroactive coverage. As you all probably know, if you're on Medi-Cal and you apply, you can also ask for retroactive coverage to be from the 3 months prior to your application. So if you apply for Medi-Cal today in February 2026, for example, if you are approved, you can also ask for Medi-Cal to be retroactive to 3 months prior to your application month. So if you applied for Medi-Cal in February, you can also ask for January, December, and November. That's 3 months of retroactive coverage. You still have to prove that you meet Medi-Cal income and any other eligibility requirements, but you can get extra 3 months of coverage. But under HR 1, that is being changed. For the expansion group, the younger adults 19 to 64, that 3 months is being cut to 1 month only. And for older adults and people with disabilities or dual eligibles, they're going to get 2 months only. So instead of that broad 3 months, 2 months for older adults and dual eligibles, and 1 month for your expansion group. And this will be an impact because it does mean that if you had a sudden health crisis and you didn't get your Medi-Cal application in immediately, you will have a smaller retroactive coverage period. And it could mean more medical debt because you're not going to get that full 3 months. You just have a smaller 2 month period of retroactive coverage as an older adult. So this will be a big change and means that people will need to get their Medi-Cal applications in much sooner, much quicker if they have a sudden health crisis and need Medi-Cal coverage. The other big change that I'm sure you've heard about are work requirements. Under HR 1, they're also called community engagement requirements, but it essentially means that to qualify for Medi-Cal or to remain on Medi-Cal, you have to show that you are either working at least 80 hours or have income more than 560 a month, or you are in school part-time at least, or you're volunteering. So you can, if you're working, volunteering, or in school, that is a way to satisfy these work requirements or community engagement requirements. This starts next year in January 2027. Again, it does not apply to all Medi-Cal enrollees, only those in that expansion group 19 to 64. There are some other limited exemptions that states must provide. So if you are otherwise subject to work requirements, but you're a parent of a child under 13, or you're a caregiver of someone with a disability or serious condition, you can ask for an exemption from those work requirements. There's also the medically frail exemption, which is more of a disability-based exemption from work requirements as well. The difficulty with the work requirements and these exemptions is you would need to be identified as someone that qualifies for an exemption, or you have to raise your hand and say, I qualify for an exemption. These work requirements should not apply to me. So it will be some of the concern is how people can proactively ask for these exemptions so they don't have to comply otherwise with work requirements. It is a big change. We don't have work requirements today. It is new for most states in the nation, and will have a huge impact. And again, for this, you have to show proof of compliance to apply for Medi-Cal and get approved. And you have to show that you were working at least 1 month prior to your application. And then you're going to be doing renewals, and you will also have to demonstrate that you met that work requirement at least 1 month during your renewal period. Based on this specific provision alone, it's estimated that 1.8 million people will lose coverage because either they can't comply, or they can't demonstrate compliance, or they could be exempt but have not been exempted under one of those specific exemptions for medically frail, or as a parent or a family caregiver, for example. But with this one, you might have noticed, but older adults, people over 65, and people with Medicare are not impacted. They're not in that expansion group. So if you're seeing patients that are over 65 or who have Medicare, they are not subject to this. It's really that younger group only. And the thing with work requirements is that, states don't have a lot of time to implement. So we just know the facts of who these work requirements apply to, but we haven't gotten yet information about how do you ask for an exemption? How do you show that you are working? How do you tell the counties that you are working, that you're volunteering, etc.? Those are the pieces that are still being worked on. So do expect more of that to come out. Beyond work requirements, renewals for that younger population are now every 6 months instead of 12 months. So today, every Medi-Cal enrollee only has to do their Medi-Cal renewal or redetermination every 12 months, so once a year. But that 19 to 64 expansion group now have to do it every 6 months. So much more frequent. It will mean much more administrative burden for the counties and on people themselves. And because that younger group is also subject to those work requirements, they also have to demonstrate that they can comply or meet an exemption during the 6 months period between their renewals. So you're going to see older adults age 50 to 64 enrolled in the expansion group that are impacted. But anyone over 65, or if you have Medicare, or you are a person with a disability in these non-expansion categories, you stay at 12 months renewals. And that one also starts next year in January 2027. So those were the eligibility-based changes about how do you demonstrate eligibility for Medi-Cal. They're going to ask about work requirements and more frequent renewals. There's also a very big change to eligibility for immigrants. So today, coverage for immigrants is pretty broad. If you are lawfully present, if you meet certain categories, you can qualify for Medicare, federally based Medicaid, as well as those covered California tax credits. Under HR 1, the immigrant categories eligible for these programs have been severely restricted to only the three groups on the slide. So only these three groups of immigrants qualify for Medicare, federally based or federally funded Medicaid, and the marketplace tax credits. So that's your legal permanent residents or green card holders, certain Cuban and Haitian entrants that came under a certain family reunification program, and then people residing under the Compacts of Free Association. Those are people from island countries like Palau or Micronesia who have a special agreement with the government to live in the US. They're given special protections. And of course, US citizens also will qualify for these programs, but that does mean all other immigrant categories that used to qualify or that may be on Medicare and Medicaid right now no longer qualify for these programs under HR 1. HR 1 is limiting health coverage for many immigrants who are still lawfully present. They just don't fall under one of these three categories. So these newly ineligible immigrants include people like refugees, people who have been granted asylum and to be in the US, survivors of domestic violence, trafficking survivors as well. People with temporary protected status are also impacted. States can choose to still cover pregnant women and children who are lawfully present, but it is a state decision. California has chosen to do that, but other states may not. And just want to add that again, these groups of people are still lawfully present. They still retain these immigration statuses, but HR 1 has just decided that they no longer qualify for those health insurance programs like Medicare or federally funded Medicaid. For the Medicare impacts, that does mean that if you are an immigrant in one of those now ineligible categories and you are now age 65, you cannot enroll into Medicare. Although you have paid your Medicare taxes and your Social Security taxes, HR 1 has decided that you no longer qualify for Medicare. That also means people currently enrolled in Medicare now will see their coverage terminated in January 2027 if they are not one of those three narrow categories of immigrants. Your green card holders, people residing under COFA, which is very small, and then that Cuban Haitian entrant category. It's really going to be green card holders and US citizens are the main groups of people that can stay on Medicare. And this is very difficult. It will mean many older adult immigrants will be uninsured because they will lose Medicare. And it breaks Medicare's promise because before, if you worked and paid taxes in this country, you would get Medicare when you turn 65. But that is no longer the case for many immigrants. And it is very difficult because those same categories of immigrants are also cut off from federally funded Medicaid. And that change takes effect this October 2026, so it's a little bit sooner. And that means those newly ineligible immigrants will no longer qualify for federally funded Medicaid. So older adult immigrants that are low income will lose both Medicare and Medicaid. And you're also prohibited from covered California tax credits. It's really a catch 22, and you aren't left with many options. Some options that do still remain for people are you can still sign up for private health insurance or through Covered California because, again, these newly ineligible immigrants are still lawfully present. They can get Covered California and private health insurance, but they have to pay full cost. They won't get the subsidies, but if they can afford to, they can pay the full monthly premium. Other resources that you can turn to or point people to are county-based health programs. So there are county programs like San Francisco, Los Angeles, or Fresno. They do offer health coverage to people on a sliding scale. So you may pay a small amount depending on your income, but it is open to anyone regardless of immigration status. And then I also put a link about the different programs under each county. And then if folks are getting care at a hospital, there's also financial assistance policies that are required by state law. Every hospital has them. And on that link, I also put in the slide, they do have copies of the actual applications itself. So those are some of the few options that remain if you're one of those immigrants that no longer are going to be covered by Medicare or federally funded Medicaid. And I say federally funded Medicaid because I'm sure you all know that California does choose to provide health coverage to immigrants regardless of status, more or less. So these newly ineligible immigrants, it's not clear if they can get on our state-based program. California does cover people regardless of status under Medi-Cal, but does so through state funds only. They are footing the bill 100% for immigrants that don't qualify under federal rules. It's not clear if California will still do that for these new ineligible immigrants. That was something that just came out in the recent budget released by Governor Newsom. So there's a lot of movement, or that policy is still in flux right now. And then there are some other changes that I did not cover, but this slide just talks about all the different provisions that were put in place and the effective date as well. And again, these slides will be shared after the presentation so you can see it up close. So to sum it up, for older adults, you're not going to be impacted in the same way that younger adults are. Those work requirements, the 6 months renewals, do not apply to dual eligibles, anyone over 65. If you're in a long-term care facility on Medi-Cal, also those work requirements are not going to apply to you. It's going to be, though, older adults that are age 50 to 64 that are in the expansion program for younger adults. So you can tell patients that you see if they're a dual, these work requirements or new renewals that they're probably hearing about do not apply to them. Same thing with anyone over age 65. So they should get no notices telling them they have to comply. And if they do get notices, that means something has gone wrong because they are excluded from those provisions. But where dual eligibles and people over 65 will be impacted is the shortening of the retroactive period. And then if they are an immigrant, they could lose Medicare and Medi-Cal, depending on the immigration status that they have. And although not directly impacted by those other provisions, there is a lot of confusion, misinformation. There's just a lot of information out there right now. So one of the things that can be done is just, telling people or being clear about who is and who is not impacted to reduce that fear and confusion. People will need to update their contact information because if you're not getting notices and you are subject to these provisions, that could put your Medi-Cal at risk. So folks do need to review their mail, complete any renewal packets that they're getting, as well as any requests from the county for more information. And then also, it's going to be really important to know the local resources that are available so that people that do come to you with questions can get the help that they need to resolve incorrect terminations, answer questions. There's a lot of new changes that are happening, so having trusted sources like legal aids or insurance navigators or immigration attorneys will be really important so that folks know what they need to do and what options they have. And it does, from the poll, it sounds like the vast majority of you have those local resources. So that is great, because that is going to be really important once those provisions actually come into effect and people start getting notices. We will start seeing outreach notices from the state later in the fall because the state is going to have to update people. This is a huge change, and there will be a lot of community outreach that will happen in the next few months. Okay, so those were the changes that happened on the federal level, and then I'll just discuss a bit that happened on the state level. So California signs its own budget. It was signed last year in June, and we had a huge deficit of $12 billion. Because of that, the state did make other choices to our Medi-Cal program and reinstated the Medi-Cal asset limit, as well as made changes to how certain immigrants qualify for Medi-Cal benefits. So under the asset limit, this is going to impact your older adult and people with disability clients, people on aged and disabled, long-term care, but it's the people who are over 65 or who also have Medicare. They will be subject or are now subject to an asset test. So to qualify and maintain Medi-Cal, you need to meet the income limit and also have less than $130,000 in assets. Assets were previously eliminated. You only had to prove your income, but that is no longer. They are back as of January 1st. And that means that if you're a new applicant to Medi-Cal after January, you have to show that you meet that asset test. And assets, again, are cars, cash. If you own a home and live in it, that is exempt. But if you have a second home, that counts toward the asset limit. One car is exempt. If you have two cars, that second car is going to count towards that asset limit. But it's again like cash, banking, savings accounts are things that are considered assets. People on Medi-Cal now don't have to do anything. They will have to certify that they meet the new asset limit when they go through their renewal during 2026. And everyone has a different renewal date, so it will be on a rolling basis. The other changes that happened were for certain immigrants. Like I mentioned earlier, California does provide Medi-Cal regardless of immigration status, and they do so using state funds only. Only certain immigrants qualify for Medicaid under federal law, which is today legal permanent residents, refugees, asylees. Under HR 1, we've changed that, obviously, but currently, right now, in January 2026, more immigrants can qualify. What that means, though, with these changes that California has put in place through our budget process, is that if you are undocumented or don't have legal status, you can no longer newly enroll into Medi-Cal after January 1st. So those folks can still apply, but are limited to that restricted or emergency scope Medi-Cal. So only for emergency services or if someone is pregnant. That does mean current undocumented immigrants that are in Medi-Cal now can remain, but if they lose Medi-Cal for some reason, it could jeopardize their future enrollment. So if you lose Medi-Cal and you lose it for more than 3 months, if you try to reapply, you can reapply, but you will be limited to that emergency Medi-Cal. So for immigrants that are undocumented, it's going to be really important for them to keep an eye out for their mail, to answer information, to do their renewals, because if somehow they lose coverage and lose it for too longer time, they can't get back on to our full scope Medi-Cal program. The other two changes that were made in the budget is that for any immigrant on our state-funded category, so that could be someone that's undocumented, it could also be legal permanent residents that are under the 5-year bar. They no longer will have dental. They can still be on full scope if they're enrolled, but dental is being taken away this July. It only applies to people 19 and older, and all other benefits remain, but no more dental. And then there will also be $30 monthly premiums that start next year in July 2027. So all in all, what it means is that immigrants on our state-funded programs will have to pay for coverage and will be getting less since they won't be getting those dental benefits. So it will be very difficult to explain these changes because it's not easy. I know this is a lot of information, and it's confusing to figure out who is impacted, who is not, because of all these different rules. But some tips for people is, again, completing renewals and updating information. If you're an older immigrant and you don't have legal status here, you're going to be impacted by those overlapping provisions, asset limits, the premiums, and the loss of dental, and the block on new enrollments. So it's depending on who you are and different identities that you may have, you will see multiple changes that impact. And then, like I mentioned, there is the overlap with HR1. So HR1 is limiting who qualifies for federally funded Medicaid for most immigrants. It is not known if these people who will be losing federal Medicaid can just be on state-funded Medi-Cal full scope. Newsom did say in the budget proposal that was released 2 weeks ago is that he is saying those newly ineligible immigrants are going to move to restricted or emergency Medi-Cal. This is extremely disappointing, but it's not final. And there's many advocacy organizations that are opposed as well, but it is something that folks should know because we don't know what will happen to those groups of immigrants that no longer qualify under HR1, whether they can still get full scope Medi-Cal under state funded programs or restricted or emergency only. If they can get state funded full scope, they will still have to pay premiums and have no dental coverage, but they will have other full scope Medi-Cal benefits. So if you do sign up for our listserv, we will be putting out updates as this policy decision becomes final or not. And then we do have a lot of resources. I know this was a lot of information. Folks don't need to know everything. I think the importance is knowing who is impacted and who is not. And even if that is difficult to keep in your mind because it is a lot. There is a lot of different pieces, moving pieces, knowing who is in your local community so that you can refer people to legal aids, high caps, navigators, insurance counselors. Those are people that do have to really be on top of all these different changes and can answer a lot of these questions so that folks know what needs to be done and if they are or aren't impacted. The last two bullets, what Medi-Cal members need to know, is put out by our Medi-Cal agency, and it puts all of these pieces into one page. And then at Justice and Aging, we did just put out a fact sheet on the asset limit that goes into more depth. And if you have other questions after the fact, you can also email me. Feel free to do so, and I can open it up to questions now if anyone has any questions on what we've talked about today.
Tiffany, I don't see any questions in the Q&A or chat. We do welcome them, so don't be shy. I know that was a lot of information, but first and foremost, I do want to thank you for really making it digestible. Your knowledge, I think just the way in which it was um, delivered is very helpful. I do have some questions that I can fill in. Hopefully this is helpful for everyone who's on. So my first question is for older adults, and I have these conversations quite often, who do not qualify, who are not dual eligible today, but they do not make enough to pay for long-term care, to pay for those extras that Medi-Cal does cover. Where can we direct them to?
I would direct them to the HICAPS, which is the Health Insurance Counseling and Advocacy Program. And I'll send a link to that after, but they are free. They provide Medicare counseling to older adults, and very often people who don't qualify for Medi-Cal because Medicare, like I mentioned, does not cover really important things that older adults rely on: vision, dental, long-term care in a nursing facility, home health aides in your home for long-term period of time is not paid for by Medicare. There are some, they're called Medigaps, but they're like private health insurance plans that may cover some of those needs. And there's different premiums involved, but the high caps are a great resource because they can tell folks, what is available in your county. These are other um, resources that you may qualify for and can help pay for those type of extra services that you're not getting through Medicare itself. And they are available in every county. And again, they're free. I think the only difficulty is the capacity for each of those high caps can vary. But many of them are also connected to a legal services program and can help people with like wills, trust, and other financially related issues that as you get older, you may need to have to put in place. So they're a really great resource because they can do the Medicare counseling, but also help folks with some legal services as well.
Thank you. And would the link there for the financial assistance policies also be a resource as well? Or
Yeah.
would, okay,
Yeah.
okay. All right. Um, I do see, oh, a couple questions popped in. Let me go ahead and grab them. Myra, can we get the slideshow emailed? Yes, that will be emailed out. Can you share the recording? The recording as well will be sent out. Omar, will you be conducting a similar presentation in a few months? Actually, I was going to go ahead and ask you, Tiffany, if we can regroup and talk about when further information comes out through the state, if we could regroup and potentially do an updated webinar with that information.
Yes, definitely. Like I mentioned, what I covered was just what is in the text of HR 1, but states actually have to implement it. So we don't know how you raise your hand and say, I, I meet the work requirements because I have a job, or I don't have to comply because I qualify for an exemption. As those pieces are finalized, we will need to do another webinar on how you actually um, meet these new rules. So definitely happy to come back and provide that update.
All right, perfect. Thank you. Thank you for your question. The next one here, for immigrants that will be affected, will they have to rely on a sliding fee discount program?
I think the reality is that likely yes. Um, if California decides to cover those new ineligible immigrants, and if they decide to keep state-funded Medi-Cal or Medi-Cal regardless of immigration status open to all, then if you qualify for Medi-Cal based on your income or your assets, you can have that. California decides not to extend that coverage, it will be terrible and it will mean folks are either uninsured or uninsured and rely on that sort of sliding scale program. And the counties themselves are going to be in a difficult position because they use county funds to provide that sort of care. And budgets are shrinking for states and for counties. So we are worried about what it would mean for counties themselves to provide that care. But that is the only thing we have right now is really those county-based programs or the financial assistance policies if you get care in a hospital. So stay tuned. That will be also something that I can update on once we know what the final policy is for those groups of immigrants.
All right, thank you. The next question here, what actions can frontline outreach workers and caregivers take now to help seniors avoid losing Medi-Cal or becoming uninsured?
I think the main thing that people can do is tell people to update their contact information and to look out for their mail. Most of the big changes will not apply to those dual eligibles or older adults, but I can see it's going to be hard to tell people which provisions and which don't, but people should always update their address so that they get mail from the county and then pay attention to their mail. Because I used to be a direct services provider and worked with older adults and Medi-Cal enrollees, and not everyone checks their mail. But nowadays it is extremely important because not checking your mail could mean a loss of coverage. And we are worried that even though older adults or dual eligible should not get any notices about work requirements, mistakes happen. And if that happens, we want those folks to know that that's not right and they shouldn't have to comply. So having people update their information, check their mail, and then directing them to those legal aids so that they can get the direct help. Because the legal aids are going to be some of those frontline workers helping people navigate the mess when the provisions go into effect.
How soon, in advance of a renewal date for beneficiaries? I know you indicated that everyone's going to have their own individual date. How soon will they receive notice of the upcoming renewal? And is there a window that they have should they miss that renewal date?
Yeah, great question. So for new renewals, again, everyone does that right now, every year, every 12 months. Um, the state and the county has to go through what's called ex parte first. So before sending out a packet to someone, when they know a renewal date is coming, the county is going to look at information in the file or through other data sources to see if they have enough information to automatically renew their coverage. If they know someone's income based on federal data, they may not actually have to send out something to a person on Medi-Cal. They can automatically renew based on information the county has at their disposal. And that is usually done in I think, 4 months before someone's renewal date. If that process, they can't automatically renew someone on their own, counties then send that mailed packet where they ask folks to verify information or fill in missing information. And that packet is sent 3 months before the renewal date. So folks have at least 3 months to fill out the packet if they get it. And if they don't fill it out and their renewal date passes, there is a cure period where you have an additional 3 months to return your renewal packet and keep your Medi-Cal or reinstate it. So there is a good amount of time for folks to complete the renewal, and if they miss it, to cure the renewal, the termination if you did not finish your renewal.
All right, thank you. And to your point, yes, there are a lot of individuals that do not open their mail. And so the proactive outreach and communication regarding what to look out for, when to look out for, and who it should be coming from, then how to take that action, I think is one of the tips that all of the advocates and frontline individuals on the call today should be stating. Next question here. For persons with expanded immigration status, currently on Medi-Cal, covered under state-funded dollars only, how soon before the budget is finalized can we anticipate knowing if the state will continue to cover?
We don't know. That one's a hard one. I know that there's a lot of organizations that are very vocal about Governor Newsom's proposal to move, these newly ineligible immigrants like asylees, refugees, who right now are on full scope Medi-Cal. And it's not fair to allow some certain groups on state funded and not others. So we're hopeful this is not final, but we won't know until the final budget is passed in June because um, they may put out or hold hearings, but they're not going to make a final decision until the final budget. So we won't know and be guaranteed until after it is signed because they may say one thing and then change their mind later. So it will be, unfortunately, not till at least June and July where we will have a final concrete answer.
Okay, thank you. I know we're coming up on time here. Will immigrants who pay taxes still be required to pay Medicare taxes, even if they no longer are eligible for Medicare benefits?
That's a great question. And the answer is yes. It is, all agree, unfair, but yes, because it is a IRS rule that people who are working have to pay those Medicare, Social Security taxes. So even though they will not gain Medicare eligibility, they have to keep paying the taxes. They still qualify for Social Security. That has not changed. So retirement, Social Security is still available to them, but Medicare is not. But they do have to still pay those taxes.
All right. Thank you for all of the questions today, everyone. Thank you for joining us. Tiffany,